Bismillahirrahmanirrahim. Good morning, everyone. I'm Dr. Jamal. My moderator is Dr. Tanzil. I'm presenting the presentation on Peyronie's disease.
Who will tell the definition of Peyronie disease? Vessel.
Peyronie's disease is the abnormal curvature of the penis while the penis is erect during erection.
Because of
It could be secondary to fibrosis of the tunica albuginea, which is a tissue present between the two corporas.
okay. Arsalan, कुछ आप add कर सकते हैं?
Sir, it is non-malignant and progressive. It may be due to trauma. Exact cause, exact mechanism is not known.
So there is a formation of plaque in the tunica albuginea, which covers the corpus cavernosum, and it will causes the curvature of the penis. Either it may be upward, laterally, and downward. Okay.
Introduction. Penile curvature, Gorby congenital are required. Congenital curvature is rare and there is no evident cause. Acquired curvature is secondary due to Peyronie's disease. Peyronie's disease is a progressive and non-malignant disorder of the penis resulting in an abnormal curvature when erect. The abnormal curvature is caused by scar tissue in the erectile tissue. However, the exact mechanism responsible for the formation of this scar tissue remains elusive. So, history of the Peyronie's disease. The condition is named for Francis Gigatila Peyronie in 1749, who was a French surgeon and co-founder of Académie Royale de Chirurgie. It was first described in 1561. So the epidemiology of the Peyronie's disease prevalence rate of 0.4 and 9% have been published. The actual prevalence of Peyronie's disease may be even higher, considering many patients' reluctance to report this embarrassing condition to their physicians. Short anatomy of the penis. The penis consists of two erectile chamber called the the penis consists of two erectile chamber called the corpora cavernosa that run along the length of the penis. During an erection, these chambers fill with blood, resulting in the increase in the size and rigidity of the penis. Each corpus cavernosum has a sheet. Each corpus cavernosum has a sheet of elastic fibers called the tunica albuginea, which is made up of predominantly type 1 collagen fibers. Etiology of the Peyronie's disease. In Peyronie's disease, a fibrous plaque form in the tunica albuginea of the corpora cavernosa. And this inelastic plaque change the smooth upward curvature of the erect penis to a kinked appearance. The exact mechanism the plaque form is yet to be definitely established. However, many theories have tried to explain the etiology of this disease. And Peyronie's disease, fibrotic form, and also the tunica albuginea of the corpora cavernosa.
So what is the most common theory refuting?
Don't know, sir.
अच्छा, और कोई बता सकता है कि फैसल अरसलान सीनियर है ना, बाबर बता सकते हैं। बाबर, मोस्ट कॉमन थ्योरी ऑफ द पेरोनी डिजीज क्या है? बैठ जाओ, आराम से बैठ। पेरोनी डिजीज की मोस्ट कॉमन थ्योरी इटियोलॉजी की क्या है?
जी सर, ये कोई ट्रॉमा है जिसके एक एट्रोजेनिक ट्रॉमा है, या सेक्सुअल कॉन्टैक्ट के जरिए जो हमारी वो होती है, उसकी वजह से कोई ब्लड या लीक करता है, जिसकी वजह से इन्फ्लेमेशन होती
ब्लड
है।
नहीं लीक करता है इसमें,
या
उस्मान ब्लड लीक करते हैं?
इसकी वजह से इन्फ्लेमेशन होती है, वो लीड करती है फाइब्रोसिस को।
Inflammation, it is a microsurgical trauma or micro trauma during penetration of the penis into the vagina may lead to the inflammation, which may lead to the fibrosis and plaque formation in the tunica albuginea. So this is the most common theory.
Generally accepted theory is that the plaque form as a result of trauma to the penis. Peyronie's disease starts with an acute inflammatory process. This is characterized by increased proliferation of tunical fibroblast, differentiate into myofibroblast, excessive deposition of collagen, the persistence of fibrin and elastin fragmentation. Risk factors of the Peyronie's disease. Previous injury to the penis is a strong predictor of developing Peyronie's disease. Genital or perineal trauma, iatrogenic injury, including catheterization, cystoscopy, and TRB, all are linked to increased risk of Peyronie's disease.
अच्छा, एक कॉमन कंडीशन होती है हैंड की जो कि पेरोनी डिजीज के साथ होती है, कौन सी होती है? यस, आगे चलो।
The most commonly associated comorbidities and risk factors are diabetes, hypertension, lipid abnormalities, ischemic cardiomyopathy, erectile dysfunction, smoking, and excessive consumption of alcohol. Diphtheria contractures is also the risk factor for the Peyronie's disease, is more common in patients with Peyronie's disease, affecting 9 to 39% of patients. 4% of patients with diphtheria contracture have reported in Peyronie's disease. Symptoms of the Peyronie's disease. The most common presentation is the male in his mid-50s who presents with recent onset of penile curvature accompanied by mild to moderate penile pain. The penile curvature, however, may either preclude intercourse or make intercourse difficult for the patient and his partner. Clinical significance is most common to many sexual disorders. Peyronie's disease can understandably cause significant distress to patients. Problems arise from the deformity and resultant impaired appearance and function, but also because Peyronie's disease is associated with erectile dysfunction, which is in itself a distressing condition. How to evaluate? Evaluation as to aim of the initial evaluation is to provide information on the presenting symptom and their duration. Erectile pain, palpable nodules, curvature, length and rigidity, girth, erectile function status. The evaluation of the disease, as that the disease active versus stable disease, it is useful clinically to distinguish between active and stable disease because treatment options differ. An active disease is characterized by dynamic and changing symptoms. Penile and glandular pain or discomfort with or without erection is the defining symptom of the active stage. Symptom onset may be associated with a history of penile injury during intercourse. Hence, stable disease symptoms have been clinically unchanged for at least 3 months based on either patient report or clinician documentation. Pain with or without erection may rarely be present, but is typically mild.
So Arsalan, what is stable disease? And what is active disease and what is stable disease?
Actually, in the initial phase, when there is inflammation and there is this, pain and these symptoms are present, it is fall in active disease. When inflammation settled and there is a fibrosis and patient symptoms like pain has been gone, then it is characterized in stable disease, and the management of both phases are different.
So why it is important to acknowledge that whether it is a active disease or stable phase?
Sir, if we diagnose in its active disease, and if we do treatment for in this phase, then it is reversible. We can delay its progression. We can reverse its condition, and once it is go in the stable phase, then we can't reverse.
नहीं, ये कहना क्या चाह रहे हो तुम?
सर मैं कहना चाह रहा हूँ कि अगर इनिशियल फेज में है तो इसमें यह है कि अगर आप उसका ट्रीटमेंट,
स्टेबिलिटी किस चीज में आएगी? इन्फ्लेमेशन तो खत्म हो जाएगी, पेन सही हो जाएगा, स्टेबिलिटी किस चीज में आएगी?
सर डिजीज
मेरे कहने का मतलब समझ रहे हो कि स्टेबल फेज कह रहे हैं ना
जी सर.
So during the course of Peyronie disease, the penile curvature elongates or it increases in size. It increases in degrees. Okay. So at the stable disease, it will stop and the degree will be stopped. ठीक है. तो अगर आप जो है वो एक्टिव डिजीज में उसकी सर्जरी कर देंगे तो फिर जो क्या होगा कि जब वो स्टेबल डिजीज में आएगा तो फिर और फिनाइल कर्वेचर हो जाएगा, तो पेशेंट क्योर नहीं हो सकेगा. तो इसलिए हम जो है वो स्टेबल डिजीज का वेट करते हैं सर्जरी करने के लिए, डिफॉर्मिटी. लेकिन एक कंडीशन ऐसी है पेरोनी डिजीज की जिसमें जो है अगर कर्वेचर हो और उसमें वेट नहीं करते, वो क्या एसोसिएशन है उसकी, किसी को पता है? उसमें फौरन सर्जरी कर देते हैं और सर्जरी थर्ड ऑप्शन यूज करते हैं. अगर पेरोनी, इतना मुश्किल क्वेश्चन थोड़ी है, इतना सीरियस हो गया आप लोग सब ना. ठीक है. तो भाई अगर पेरोनी डिजीज के साथ इरेक्टाइल डिसफंक्शन भी हो तो उसमें आप पेनाइल प्रोसेसेस पहले भी लगा सकते हैं. ठीक है. तो उसके लिए स्टेबल डिजीज का होना जरूरी नहीं है. ठीक है. अगर पेरोनी डिजीज विद इरेक्टाइल डिसफंक्शन है तो उसमें आप पहले सर्जरी कर सकते हैं. लेकिन अगर पेरोनी डिजीज विदाउट इरेक्टाइल डिसफंक्शन है, समझे, इरेक्शन पेटेंट है और पेरोनी डिजीज है, तो फिर आप स्टेबल डिजीज का. समझ आई फैसल? आपको क्या समझ आया बताएं? सर्जिकल ट्रीटमेंट जो है हम अर्ली भी कर सकते हैं. किस कंडीशन में कर सकते हैं? जब
डिसफंक्शन हो,
इरेक्टाइल डिसफंक्शन हो. पेरोनी डिजीज के साथ इरेक्टाइल डिसफंक्शन हो और इरेक्टाइल डिसफंक्शन किसी भी चीज से करेक्ट ना हो रहा हो, मेडिकेशन से, आईसीआई, इंट्राकोवेनल इंजेक्शन से करेक्ट ना हो रहा हो, तो आप उसमें जो है वो पिनाइल प्रोसेसेस लगा सकते हैं किसी भी टाइम, 3 महीने पे, 2 महीने पे, 1 महीने पे. ठीक है. चलिए.
History and examination. A comprehensive history should include detail presenting complaint, past medical and surgical history. The sexual history is also particularly relevant in Peyronie's disease. Penile examination consists generally of a palpable node or plaque. The whole of the penis should be examined. Plaque size is measured in the erect penis. Diagnose. Clinician should engage in a diagnostic process to document the signs and symptoms that characterize Peyronie's disease, clinician should perform an in-office intracavernosal injection test with or without Doppler ultrasound prior to invasive intervention. And clinician should evaluate and treat a man with Peyronie's disease only when they have the experience and diagnostic tool to appropriately evaluate, counsel, and treat the condition. Treatment
पेंटोलम कौन सा देते हैं? इंट्राकेवर्नोजल इंजेक्शन ओपीडी में देते हैं ना हम. अरसलान होता है हमारे साथ. पेंटोलमीन देते हैं. नहीं नहीं यानी आईसीआई इंट्राकेवर्नोजल इंजेक्शन लगाते हैं ना. हाँ, कौन किसने बोला? पेपरवरीन. हम यूजुअली, क्योंकि हम पाकिस्तान गरीब मुल्क में हैं, तो इसलिए जो है वो हम पेपरवरीन यूज करते हैं, वरना बायोमिक्स और ट्राइमिक्स भी यूज कर सकते हैं. तो क्या है बायोमिक्स, ट्राइमिक्स, कुछ किसी को पता है? भाई क्या होता है? जमाल को पता होगा, वो आखिर में बैठा हुआ है. जमाल नजर ही नहीं आ रहा. भाई बायोमिक्स में क्या होता है और ट्राइमिक्स में क्या होता है? ये इंजेक्शंस के नाम है. तो बायोमिक्स में जो है वो, अगर मैं गलत कह रहा हूँ तो उस्मान करेक्ट करेंगे, एक फेंटोलमीन और पेपरवरीन होता है, और जो ट्राइमिक्स में फेंटोलमीन, पेपरवरीन और एल्प्रोस्टेटिल होता है. ठीक है, तो ये इंजेक्शंस मोर पोटेंट है अगर आप पेपरवरीन यूज करेंगे तो उससे ज्यादा. लेकिन हम, क्योंकि जो है वो पेपरवरीन बहुत ही ज्यादा सस्ता है, तो इस वजह से हम अपने जो है क्लिनिक में जो है वो आईसीआई लगाते हैं, तो पेपरवरीन के साथ लगाते हैं. ठीक है, चले आगे चलें.
ट्रीटमेंट
किसी को रिसेंट कोई पता है जो एक्टिव डिजीज में रिसेंट ट्रीटमेंट हो और उसका कोई बहुत ही जो है वो अच्छा रिजल्ट हो? ओरल है, टॉपिकल है, इंट्रालीजनल है, सर्जिकल है. सर्जिकल तो एक्टिव में करनी चाहिए, एक्टिव में नहीं करनी चाहिए अगर इरेक्टाइल डिस्फंक्शन नहीं है. ठीक है, अगर इरेक्टाइल डिस्फंक्शन है तो फिर करते हैं, इरेक्टाइल डिस्फंक्शन नहीं है तो फिर नहीं करनी चाहिए. ठीक है, तो कुछ समझ आ रहा है, नहीं आ रहा? मरियम कहाँ है? समझ आ रहा है तुम्हें या नहीं आ रहा? ठीक है, तो किसी को पता है कोई रिसेंट कोई ट्रीटमेंट है जो बहुत ही महंगी ट्रीटमेंट है और जो है वो यूज कर रहे हैं पेरोनीज डिजीज में, और सिर्फ यूएसए में यूज होती है? ये है कुछ नहीं. क्या होता है? बोलो अबे बोलते जाओ भाई, सब बोलेंगे तो फिर कुछ आएगा, नहीं तो मेरी तरह आप जो है खामोश रह जाएंगे जिंदगी में.
सर, टिश्यू ग्रोथ फैक्टर 1 इनहिबिटर.
ये कौन सा होता है? अच्छा, और किसी को पता है? चलो आगे पढ़ते हैं. आगे चलो पढ़ो.
treatment is important to recognize that Peyronie's disease is a symptom complex that may compromise sexual function and quantity of life, but does not appear to affect the survival. Given this, given this content opposing a treatment plan, the clinician should carefully weigh the potential benefit to the patient of particular treatment against that treatment risk and for adverse event, the severity of the adverse event and the reversibility of the adverse event. So treatment, we have the just 4 option: oral, topical, intralesional and surgical.
So which treatment we are using for the active disease in our OPD? हम कौन सी ट्रीटमेंट यूज करते हैं? आगे ओरल यूज करते हैं. ओरल में क्या यूज करते हैं? विटामिन ई और
रिसेप्टर एंटागोनिस्ट देते हैं, टेमोक्सिफेन यूजुअली.
टेमोक्सिफेन देते हैं, but there is no role of tamoxifen. It will only decrease the pain
Pain and
pain
symptomatic
during
treatment
active
for
disease.
that.
But it will not decrease the penile curvature, and it will not decrease the penile shortening of the patient. So the only recent treatment is injection Xiaflex. So what is injection Xiaflex? And it is an intralesional injection. So Xiaflex is a collagenase, and it will decrease the amount of collagen if we inject this injection into the intralesional into the plaque, and it will soften the plaque. And then what happened? Then there is a decrease in the penile curvature at lateral stage, and there is a decrease in the penile curvature, and it will significantly decrease. यानी अगर पेनाइल कर्वेचर आप ऐसे ही एक्टिव डिजीज में छोड़ देंगे इसको और इंट्रालीजनल इंजेक्शन नहीं लगाएंगे, तो फिर क्या होगा कि वो 49 या 50 डिग्री तक पहुंच जाएगा पेनाइल कर्वेचर, या उससे भी ज्यादा आवर ग्लास डिजीज भी हो सकती है. लेकिन अगर आप एक्टिव डिजीज में इंजेक्शन Xiaflex और ट्रैक्शन थेरेपी करेंगे, ठीक है, उस ट्रैक्शन पेनाइल ट्रैक्शन थेरेपी जो होती है उसमें एक डिवाइस यूज होता है जिसे कहते हैं रेस्टोरेक्स. तो अगर इन दोनों की कॉम्बिनेशन करेंगे, इंजेक्शन Xiaflex एंड रेस्टोरेक्स, तो क्या होगा कि इट विल डिक्रीज द पेनाइल कर्वेचर डिग्री लेटर ऑन, एंड if we'll not do any treatment, then it will increase the penile curvature up to 50 or 60 or 70 degree. And if you will do this therapy, then it will decrease the penile curvature up to 12 to 10 degree. So there will be no further surgical intervention required if we use injection Xiaflex and traction therapy. And it is very expensive. The cost of one injection is about $3,300, and total 8 injection is given intralesionally, and the total cost is $26,000, and is very expensive, and it is only used in USA. It is only used in USA because FDA did not approve in Europe. तो एक्टिव डिजीज में न्यू ट्रीटमेंट इंजेक्शन Xiaflex और ट्रैक्शन डिवाइसेस आ गई हैं जो कि लोग यूज करते हैं, जिससे पेनाइल कर्वेचर डिक्रीज हो जाता है. ठीक है, आगे करें.
ट्रीटमेंट oral, topical, intralesional, and surgical. First is the oral treatment. Oral treatments have vitamin E, potassium para, aminobenzoate, tamoxifen, colchicine, acetyl of chematin, and pentoxifylline. In the EAU guideline, the conservative treatment for Peyronie's disease is primarily aimed at treating patient in the early stage of disease. It is an option in patient not fit for surgery or when surgery is not acceptable to the patient. But in American Urological Association guidelines, they said in the penal judgment, the use of therapies without efficacy, even in the absence of significant adverse events, substitute a moderate risk burden in terms of postponing or preempting the use of other efficacious treatments. The inability to alleviate patient distress, the time expended on treatment that do not work, and the cost associated with these medication or substances. Further, the panel note that oral therapies are not appropriate for patient with stable disease. Intralesional treatment and the intralesional treatment have used steroids, verapamil, clostridial collagenase, and interferon. Intralesional treatment with verapamil may induce a significant reduction in penile curvature and plaque volume. And also use of clostridial collagenase showed significant decreases in the deviation angle, plaque width, and plaque length. And using of the interferon may improve penile curvature, plaque size, and density, and pin. Now, the topical treatment for the Peyronie's disease, topical is the verapamil, inotrophoresis, and ESWL. Topical verapamil gel 15% may improve penile curvature and plaque size. And the use of inotrophoresis with verapamil 5 mg and dexamethasone 8 mg may improve penile curvature and plaque size. But the use of ESWL wave treatment failed to improve penile curvature and flake size, and it should not be used with this intent, but may be beneficial for penile pain. American Urological Association also agree with this. Other non-surgical options is the traction devices. And the in the traction device, we have used a vacuum device. Vacuum device is a conservative treatment for the Peyronie's disease. It will use manual or electric devices. And you have seen in the picture, purpose the proposed protocol is 10 to 15 minute daily for the 3 months. Curvature improvement up to 25° will occur, and the successful rate is around 70%. And another one is the penile traction therapy. This is also the conservative treatment for the Peyronie's disease. Curvature improvement up to 45°. Successful rate is around 60%. This one is the traction, and this one is the vacuum devices. And now come to the surgical option.
अच्छा, when we'll do the surgical option? कब करेंगे? अभी तो बताया था. जब disease stable हो जाएगी after 9 to 12 months of initiation of the symptom. Usually जो है 9 to 12 months के बाद जो है वो disease stable हो जाती है, penile curvature रुक जाता है, जिस डिग्री पे होता है तो उसी डिग्री पे रहता है. और ये आप assessment कैसे कर सकते हैं? आप clinically assessment कर सकते हैं, with photograph कर सकते हैं, तो कंपेयर कर सकते हैं जो पुराना फोटोग्राफ था उसको रीसेंट फोटोग्राफ विद डायरेक्शन के साथ, ICI इंजेक्शन देके कर सकते हैं. तो ये जो है वो क्लिनिकल असेसमेंट होती है. अगर पेशेंट का कर्वेचर, पेशेंट का पेन रिजॉल्व हो गया है, इफ द पेशेंट्स पेन इज रिजॉल्व एंड द कर्वेचर इज स्टेबल अप टू 3 months, देन वी कैन से दिस इज अ स्टेबल डिजीज. ओके, ये जो पीछे ये डिवाइस जो है, ये वाली डिवाइस में जो बात कर रहा था, दिस इज द पेनाइल ट्रैक्शन डिवाइस. ठीक है, और इसका एक जो है कमर्शियल नेम आता है रेस्टोरेक्स. बहुत ही जबरदस्त डिवाइस है. तो उससे जो है वो 45 अप टू 45° तक आप पेनाइल कर्वेचर को बचा सकते हैं. तो इट मींस अगर आप इंट्रालीजनल कोलिजनेस लगाएं और पेनाइल ट्रैक्शन डिवाइस यूज करें जैसे रेस्टोरेक्स है, तो उससे जो है वो आप क्या कर सकते हैं कि पेशेंट को सर्जरी से बचाने की कोशिश कर सकते हैं कि लेटर ऑन पेशेंट को सर्जरी की जरूरत नहीं पड़ सकती. ओके,
Surgical options, although conservative treatment for Peyronie's disease should usually result in full erections, only a small percentage of men experience significant straightening of the penis. So the aim of surgery is to correct curvature and allow satisfactory intercourse. Surgery is indicated only in patients with stable disease for at least 3 months, although a 6 to 12-month period has also been suggested. Guideline recommendation for the surgical treatment for penile curvature. The surgery, the two major types of repair may be considered for Peyronie's disease: penile shortening and penile lengthening procedures. Penile shortening procedure include the Nesbit wedge resection and the plication technique performed on the convex side of the penis. Penile lengthening procedure are performed on the concave side of the penis and require the use of a graft. First of all, we're explaining the Nesbit procedure, and I will show you that a short video regarding this procedure. But in the Nesbit procedure, we are incise the fascia, box fascia longitudinally, and the corpora cavernosa sides and free from the surrounding tissue when a curvature is ventral. As in this case, dorsal neurovascular bundle is also freed after achieving artificial erection. Couple of more of modified bent Elias clamps are applied to penis to grasp the gather tenuical vagina on convex side of the penis. They are readjusted until penis is completely straightened.
From 30 to 60 degree, if the curvature is more than 30 degree but less than 60 degree, then we have to do the Nesbit procedure. So this is the circumcising incision, and we are degloving the penis. So penis is degloved. Now artificial erection is done, and there's a maximum curvature, and now they are incising the bugs fascia. Still bugs fascia. Now tunica albuginea is exposed, and they are taking the stitches at tunica albuginea at the maximum site of curvature. Now artificial erection was done, and they are closing the bug fascia, and penis is straight. So this is the Nesbitt procedure. Now what we are doing at SIUT, we are doing Yakia's procedure.
And next, the Yakia procedure. The Nesbitt procedure was being modified by the Yakia and consists in making a single or multiple 1 centimeter longitudinal incision along the convex side of the tunica, which are subsequently closed horizontally. By doing so, it would be expected a reduction in the injury to the neurovascular bundle and glands hypoesthesia. Next surgery is the plication technique. Plication surgery, the plication procedure use the same principle as the Nesbitt operation, but are simpler to perform. They are based on single or multiple longitudinal incision on the convex side of the penis, closed in a horizontal way. Another modification has been described as the 16 dot technique. With minimal tension under local anesthesia, the use of non-observable sutures reduce recurrence of the curvature. Result and satisfaction rates are similar to the Nesbitt procedure. Short video regarding the plication technique.
Hello everyone, today I will present you a case of penile plication that grows without rectal dysfunction. I will do this through a non-deductive approach. This way we avoid risk of infection. You can see after I measure the use of stress, I increase the rectal balance curvature, which is moved to approximately 45 degrees towards the curvature. I take my incision right in that central midline cafe, and then I dissect the target 50 and 100 startles, I dissect underlying from that. After this, I go ahead and mark the point of maximal curvature along with the point of plication. This is a modification of Combrew's system dot plication technique. Combrew's was a world-renowned professor with California San Francisco, and I use O epibond. Important that prevention. As you can see, I start from going above the point of maximal curvature to the bar, and then go below the point of maximal bar to the bar one. Now I tie one knot without locking. This allows me to test the direction and make sure that the so now we're testing the direction. And curvature, and now I go ahead and lock the now we're finishing up. We will finish tying the screws and test the direction one last time. You can see from a 45-degree angle to a completely straight penis. Here's a picture 1 month after the surgery.
Next is the penile lengthening procedures. Tunical lengthening procedures entail an incision in the short concave side of the tunica to increase the length of the concave side, creating a tunical defect that is covered by a graft. However, plaque removal may be associated with high rate of postoperative erectile dysfunction due to venous leakage. Penile prosthesis implantation is typically reserved for the treatment of Peyronie's disease and patients with erectile dysfunction, especially when they do not respond to the phosphodiesterase 5 inhibitors. Although all type of penile prosthesis can be used, implantation of an inflatable penile prosthesis seems to be the most effective in these patients. This is the EU guidelines recommendation on surgical treatment for penile curvature. Surgery is indicated when Peyronie's disease is stable for at least 3 months. Penile length, curvature severity, erectile function, and patient expectation must be assessed prior to surgery. Tunical shortening procedure, especially plication technique, are the first treatment option for congenital penile curvature and for Peyronie's disease with adequate penile length. Grafting techniques are the preferred treatment option for patient with Peyronie's disease with no adequate penile length if curvature is more than 60 degree and presence of special deformities. Last, penile prosthesis implantation with or without any additional procedure is recommended in Peyronie's disease patient with erectile dysfunction not responding to pharmacotherapy. Thanks.